Greetings. Thanks for joining today's webinar, Metabolic Syndrome, Knowing Your Risks. My name is Lisa Holland. I'm the president of the Stay Fit Plan. I've been in the healthcare arena for over 25 years, and I've become a subject matter expert in employee health and productivity management. My primary passion is to help people just like you to increase your knowledge about primary prevention and understanding how lifestyles and behaviors and improvements and engagements in healthy activities can improve the quality of your life so that you can lead a healthy, wealthy, and happy life. I hope the information in today's presentation will help you do just that. Before we get started, I always like to share that the information in today's webinar is for information and educational purpose only. It is not to undermine or replace the information that you're currently receiving from your primary healthcare physician. We hope to augment any information that you are receiving from your personal healthcare physician and just use the information from today to maybe ask questions and maybe further explore your healthcare plan. So what are we going to learn today? I'd like to define metabolic syndrome, give you some information there, discuss the risk factors associated with metabolic syndrome so that you can determine if you're at risk. I want to go over the health implications of metabolic syndrome and how important it is to know your numbers and be accountable and responsible in your personal health care. And then go over some preventive practices to keep you healthy, to stay healthy, and live that quality life that we've just talked about. The health of America is changing, and it's getting scary. Today, 1 in 4 adults are overweight or obese. This is alarming. 1 in 5 Americans still smoke cigarettes, even after all the information that we know about how detrimental this can be to your health. 1 in 3 adults have high blood pressure, and some of them don't even know it. We'll talk about that later. 1 in 10 adults are diabetic, and this goes to the 1 in 4 adults being overweight or obese, because we know that obesity leads to type 2 diabetes, a costly chronic condition. 1 in 10 adults have heart disease. What does all of this mean? Well, it means that 1 in 4 adults have metabolic syndrome. So, what does this mean? What is metabolic syndrome? Metabolic syndrome is a cluster of certain health risk factors, and when they're found together, they can increase your chance for future cardiovascular problems and other debilitating diseases. Metabolic syndrome is a serious health condition, and it affects 34% of the adults in today's population and places them at higher risk for cardiovascular disease, diabetes, stroke, and other diseases of the arterial walls. The underlying cause of metabolic syndrome includes being overweight, physically inactive, and then there are genetic factors that may predispose you to metabolic syndrome. So let's talk briefly about the genetic factors here. Your race and gender may place you at risk for metabolic syndrome. And when we consider the same 2 groups of people, Caucasian and African Americans, and we consider the same body mass index of these 2 groups, Caucasian males, white males, are actually at higher risk for developing metabolic syndrome than the African American males, and men in general are more likely to develop metabolic syndrome than females. So all of you guys listening out there, pay attention, because you are at higher risk for developing this debilitating disease than the females out there. And as you can see from the list of the chronic diseases listed on this slide, this disease poses some serious clinical risks and implications and can impact the quality of your life. So let's go through these very briefly. Hardening of the arteries, also known as arteriosclerosis. Diabetes, I think we all know this. The more overweight you are, the more physically inactive you are, the more at risk you are for type 2 diabetes. Heart attacks sometimes can happen instantaneously in a heartbeat. Kidney disease can come on gradually. If you're at risk for kidney stones, be careful. This could be a predisposing factor for metabolic syndrome. Stroke. Suddenly, you have that stroke, that you have that similar to that heart attack. Non-alcoholic fatty liver disease, be careful of those gallstones. This is predisposition to metabolic syndrome. Peripheral artery disease, sometimes a precursor. We can see some exacerbation of our or varicose veins in our lower extremities. Be on the lookout for these signs and symptoms. And then overall cardiovascular disease usually comes on gradually, and this is where we need to start looking at our numbers, especially our cholesterol numbers. So as I mentioned, metabolic syndrome is a cluster of 5 health risk factors, and these are listed here. We're looking at weight, blood pressure, blood glucose, decrease in HDL, which is your good cholesterol, and elevated triglycerides. The presence of 3 or more of these risk factors places you in a diagnostic category for metabolic syndrome. We're going to talk about the importance of knowing your numbers, and some of these you can actually monitor yourself. So there's a lot of research out there that talks about the apple-pear body type. As we discussed, men are at higher risk of metabolic syndrome than females. Why? Because they're predisposed to an apple-shaped body type versus a pear-shaped body type. People who have metabolic syndrome typically have an apple-shaped body type, meaning that they have a larger waist and carry a lot of weight around their abdomen. It's thought that having a pear-shaped body, more prone for a woman's shape, where you're carrying less weight around your abdomen and more weight around your hips and your waist is narrowed, actually puts you at lower risk for developing diabetes, heart disease, and other complications of metabolic syndrome. Because metabolic syndrome is comprised of this cluster of factors, one way to determine your risk is to obtain lab work. The caveat here is that usually this must be prescribed by your physician. So in order for you to really determine your overall risk, knowing your numbers is critical to understanding your risk for metabolic syndrome. This condition is not the only thing that you can do, though. I mean, knowing your numbers is important, but there are things that you can do as an individual to understand some of the categories here within knowing your numbers. In fact, there are 2 risk factors that you can monitor yourself, and those include your physical activity. I mean, all you need to do is ask yourself, are you physically active or inactive? And how active are you? Are you sedentary, where you're getting less than 1 day of 30 minutes of moderate intensity activity? Or are you moderately active? Or are you highly active? And then the other is your weight. Where do you fall in your, quote, BMI category? And we can also look at that through waist circumference, and we're going to talk about that in just a second. BMI is the gold standard for weight measurement, and clinicians do continue to use this when you have your annual visit with the physician. However, there's a lot of controversy around BMI because body shape may interfere with an accurate measure. And we think about somebody who's very muscular who may have a BMI that places them in an at-risk category, but their body fat and waist circumference show that they are not at risk because of their body composition. So according to the National Institute on Health, a high waist circumference is also associated with risks for type 2 diabetes, cholesterol issues, and high blood pressure. You can use waist circumference as a useful tool to help you determine if you're also at risk for metabolic syndrome versus just using BMI. And in the example I talked about, a lot of people love to use waist circumference because if they happen to be athletic and they have a muscle mass that puts them in an at-risk category, a waist circumference will generally indicate that they're not at risk so that they can continue to monitor where they stand in overall risk for other chronic conditions. However, it is important to note that changes in your waist circumference over time will dictate and indicate if you're at risk for other chronic diseases because abdominal fat is one of the key indicators for risk of metabolic syndrome. The best way to determine your waist circumference is to locate the upper hip bone and place a measuring tape around your abdomen. Your tape measure should come in that horizontal fashion right below or at the navel baseline and should be snug but not compressed when you're doing that measurement. Now for women, your waist circumference should be less than 35 inches to make sure that you're at ideal values or not at risk for metabolic syndrome. And for males, you want to be less than 40. Now guys, I do want to caution you, a lot of men think that their belt line is their waistline. This is not the case, and you need to make sure when you're using that measuring tape that it is at your navel, just as shown on this slide. Now, the other risk factor that we talked about is blood pressure. How can you measure your blood pressure? Well, there are retail pharmacies that make blood pressure readings available to the general public without an appointment. And in fact, your physician's office may also accept you as a walk-in without a fee or a copay for a simple blood pressure check. Knowing your blood pressure is important because it's one of those risk factors that can lead you to the next steps of needing to know whether you need to work with your physician for that deeper analysis of the blood work that you need that will ultimately lead to the diagnosis or the non-diagnosis of metabolic syndrome. Keep in mind that blood pressure is known as the silent killer because you may have high blood pressure and not even know it, because the only way to know if you have an elevated blood pressure is to get it checked. So make sure that you're having periodic checks and utilize some of the community resources that are available so that you can have this reading or this measure without having to go to your physician per se. Now, if you think you are at risk for metabolic syndrome based on some of the self-assessment that you can do through waist circumference, some community resources through blood pressure monitoring, and your own assessment of your physical activity level, then you need to really work with your physician to understand if that diagnosis is truly there. And you don't want to delay this visit if those risk factors do present. And you need to determine if there are other variables that are going to happen within this diagnosis, remembering that metabolic syndrome is a composition of 3 to 5 risk factors that we've talked about. After all, the diagnosis of metabolic syndrome left untreated can be detrimental to your personal health. So early diagnosis is essential to actually either prevent or reverse the condition, and you can do this through behavior and lifestyle changes. Keeping in mind, again, that those 5 factors need to be assessed, and the lab work that you need to ultimately determine the diagnosis must be ordered by your physician. In some cases, though, through your worksite health promotion program, if available, you actually may have the opportunity to know your numbers without having to go to your physician. I strongly encourage you to take advantage of these types of events because this is a great way to understand if you're at risk for metabolic syndrome, because you will have all the numbers you need, and then you can take that next step to make an appointment with your physician. So what will happen after you meet with your physician? Well, your physician will order some blood work, and this really becomes a valuable piece of the puzzle in the diagnosis of metabolic syndrome. Again, recognizing those personal risks of physical inactivity and central obesity was that first step that we discussed and got you to your physician. But now comes the tough part, getting that blood work. So you've gone to your physician, you've made the self-assessment, but so many times once you've gotten to that next step of actually going to the lab and getting the blood work, people don't do it because they're afraid of needles, or they just don't understand how important this diagnosis is so that you can start the treatment regimen. In order for your physician to truly know if you have metabolic syndrome, you must get the necessary blood work, which includes the blood pressure, which is probably done in the office. They'll probably do a height and weight analysis, but he needs or she needs the triglycerides and the HDL information, as well as your fasting glucose, to understand your risk factors. Okay. So you've gone through the gamut. You've done the self-recognition. You've coordinated with your physician. You've had the blood work done. You've had the diagnosis done. Now what? What are the clinical next steps that you need to take? Well, first of all, your physician is probably going to tell you there needs to be some lifestyle changes that you need to address. He's going to encourage you to adopt a healthier diet, to encourage you to adopt some physical activity into your lifestyle. He may also or she may also prescribe some medication to control your blood pressure, your cholesterol, and maybe some other symptoms. It is so important that you carefully follow your practitioner's instructions because a plan prescribed can help prevent the long-term effects from metabolic syndrome. As I mentioned at the very beginning of this presentation, this is a serious condition with detrimental effects to your life. So please listen to your physician and follow that plan. Every step counts, and your hard work and attention to your care plan will make a difference in your health, your lifestyle, and the quality of your life. So hopefully you're not too scared, but maybe a little scared, and maybe scared enough to say, how can I avoid this diagnosis? Well, the answer, sometimes simple, is that prevention is the key. You can actually prevent metabolic syndrome from happening and reduce your risks through lifestyle and behavior changes. I'm not saying this is simple. We've talked about this so many times if you've attended other webinars. But you've got to make a conscientious decision to engage in your health and engage in activities and lifestyle behaviors that are going to promote a healthier you, a quality lifestyle, and reduce your chances of getting chronic, debilitating, and costly chronic disease. Manage your weight. I know, easier said than done, but even 5 pounds can make a big difference in your risk for metabolic syndrome and other chronic conditions. Increasing physical activity. If you don't exercise at all, adding walking to your daily routine, a simple act of walking 20 minutes a day, maybe after dinner with your spouse, maybe early in the morning before you go to work. Figure out when you can fit it in. It's one of the safest forms of exercise. It's easy to do. It doesn't cost that much. It doesn't require any expensive gym memberships, and you can do it any time of year. Eat a heart-healthy diet that's rich in whole grain foods, low in natural sugars, high in lots of vegetables and fish, all those good omega-3 fats that are good for your heart, reduce inflammation, and promote good heart health. Be sure to follow adult preventive clinical guidelines, making sure that you're looking at those guidelines, your age, your gender, and when you should be getting different screenings to make sure you're effectively managing your health. Leverage worksite health and wellness programs like the Know Your Numbers campaign I talked about. If your employer is offering wellness at the worksite, please do engage, because these are important things that can help you lead a healthier life. Here are the adult preventive screening guidelines. These are based on age and gender. You have certain things that are not necessarily required, but are strongly encouraged you to do to promote a healthy life. These are clinically based, and we want you to engage in these activities so that you can lead a quality life, a healthy and happy life, and you can enjoy your retirement and hopefully travel a lot, you know? If you're sick, you're not going to be doing a lot of traveling, right? So one of those things, the most difficult thing, especially as we get older, is managing our weight. We have a tendency to get less sedentary. Most of our jobs today are sedentary, so weight management becomes increasingly difficult for us as adults. We also know today that 1 in 4 adults are overweight or obese. It's almost up to 63% of the adult workforce is either overweight or obese. This is an enormous fact, and we've got to do something about it. It is detrimental to our health and to the quality of our life. We have to look at controlling our portion sizes. They just clearly are out of control. We need to cut back. We need to reduce our calories and balance the amount of food that we're putting into our bodies with the exercise that we need to burn that energy that we're consuming. We can monitor this through waist circumference, as we talked about before. So goal for women is a waist circumference of less than 35, and for men it's less than 40. Reduce your risk of heart disease by successfully losing weight and keeping it off. Again, I know this is easier said than done. Calorie intake is so important. We've got to burn the energy that we're consuming. We're just not doing that this day and age, and it's so important that we've got to incorporate exercise with our weight management plans. Today's portion sizes have grown up to 2 to 3 times the amount of food needed or required by our bodies, especially since we're leading that sedentary life. This guide can be used by everyone, and the cool thing about this portion guide is you're using your own hand, and each individual's unique portion sizes as well as calorie intake is based on their body type. Well, your hand is a representation of your body type. So if you're a big guy and you're 6'4", you're probably going to have a big hand. So portion control using your hand is going to be appropriate for your caloric intake as well as your portion control. The same thing for a petite woman. If you're a small woman, you're going to have a small hand. So this is a great recipe for understanding how to control your portion right at your fingertips. So keeping in mind that you want to keep lean meats and proteins to a deck of playing cards, using that handful or fistful to determine your portion control. So when you look at the palm of your hand, that's your portion size. I know it seems small, but that's really all that you need for that serving size for that particular meal. Looking at a tennis ball or a fistful, handful, if you will, for your fruits and vegetables, maybe some of those carbohydrates. Snacks. Let's start looking at our thumb or our thumb tip or even a handful when we look at pretzels or popcorns or cheeses, okay? This is a great way, literally at your fingertips. You don't need anything else, no other handy guides, no other apps. You can literally look at your hand to determine your portion control. When we talk about eating healthy, adopting a diet that's rich in whole grains, low in natural sugars, okay? So good sugars, natural sugars are good for us, but we still need to look at the sugar content content of those natural fruits. Because believe it or not, apples, bananas might have as much sugar content as a candy bar. So we have to be careful about the fruits that we're selecting. Vegetables, lean meats, fish, all of those things that are high in omega-3, those good fats, and low in those saturated fats of omega-6. And we need to avoid those processed foods, which are high in sugar, soy, and omega-6, which are all the bad things that actually addict us to sugar and food, causing the obesity epidemic that we're seeing today. We have to remember that an anti-inflammatory diet is the essential diet that will lead to the reduction of chronic illness such as metabolic syndrome. We've talked a lot, and if you've attended some of our other webinars, we are a proponent of the anti-inflammatory diet. Anti-inflammatory foods impact every type of chronic illness that we're seeing today in America. Metabolic syndrome, obesity, diabetes, cardiovascular disease. The foods that we eat are causing the problems that we're seeing in healthcare today. It is not cholesterol that's causing heart disease. It's the inflammation of the arterial walls that's causing the cholesterol that's actually good for you to help the free-flowing blood within your system. It's the compression of that through the arterial walls through your diet that's causing the heart disease. So an anti-inflammatory diet is essential to good health. Your body depends on good foods for strength, physical fitness. Eating a variety of healthful foods and natural foods ensures the best possible nutrition of the essential vitamins, minerals that you need. Processed foods are not natural foods and contain large amounts of omega-6. This is the inflammatory factor, okay? These include soybean, corn oil, sunflower oil, vegetable oil, coconut oil, and the list goes on and on. Large quantities are not good for you and cause the inflammation that it leads to chronic conditions that we've talked about today. Unfortunately, America has been led astray by the faulty thinking that you should have a diet low in fat, high in polyunsaturated fats and carbohydrates. The contrary is true, okay? Diets containing normal amounts of saturated fats and a moderate amount of starch that are low in simple sugars and table sugars are actually good for you, okay? It's all about moderation, portion control, balance, input, output. The American Diabetes Association describes eating a variety of complex carbohydrates and a moderate amount of proteins and fats is the key to essential weight management and weight control and eliminating or reducing chronic health conditions. So I can't stress this enough. Look into anti-inflammatory eating. It is the way to lead a healthier life. Appropriate selection of fruits and vegetables is also important to your diet. So many times people are fooled by thinking they're eating healthy because they're consuming adequate or even higher amounts of fruits and vegetables in their diet. So I just talked about this on the last slide. So while this is a valiant effort, the question is, are the fruits and vegetables low in natural sugars? Today's culprit in the American diet is sugar. We're addicted. It's almost like a heroin addict. Most of it comes from the processed foods we eat, but many, quote, healthy foods have high levels of natural sugar, and you need to consider the portions so that you're selecting the right foods so that you're not consuming high levels of sugar. Now on this slide, we're showing you that the total sugar content of fruits and vegetables can be misleading. And we're using sugar cubes, or a sugar comparison, if you will, to illustrate sugar content and the comparison against a healthy substitute versus a bad substitute. Fruit and vegetables probably have other health benefits, obviously, that outweigh sugar content, and we need to understand this when we're making those selections. But I'm using this slide to illustrate that not all fruits and vegetables are created equal. And in fact, a strawberry may be a healthier choice than a grape, um, and because they're both natural, but some of them have a higher sugar content than the other. So when we see this, we're looking at the grapes, which clearly have a higher sugar content than a strawberry. So when you're thinking about your selections, you clearly want to select a strawberry over a grape based on the sugar content. And if you look at vegetables, it's clear here that when we look at consuming 4 carrots, if we break that up into carrot sticks, and we think we're really eating healthy, we're actually having the equivalent of 3 Oreos. So you need to kind of figure it out. Like, what are you going to do? Are you going to have those 3 Oreos that are probably going to make you want to have the whole bag of Oreos, or are you going to have the carrots? So let me also give you some other examples of naturally low sugar fruits. So for example, an avocado are very low in sugar with only about 1 gram of sugar in an entire avocado. Cranberries contain about 4 grams of sugar per cup. Raspberries contain about 5 grams of sugar per cup. Blackberries contain about 7 grams of sugar per cup, and strawberries contain about 7 grams of sugar per cup. These particular good selections are also highly antioxidants and have been shown through research to prevent cancer. So probably good selections when you're looking into eating healthy. Okay, so we've talked about diet, we've talked about weight. Of course, there's physical activity. And I know this is a lot to take in. And when we do things in small increments, it makes things easier. So think about change in small incremental steps. But we know that we also need, in addition to our weight control and our healthy eating, we also need to balance this with adequate amounts of physical activity. We've become a very sedentary America. Most of our jobs are sitting at a desk, working at a computer. We're not getting up. We're not moving enough. In fact, the CDC recommends 150 minutes of moderate, vigorous physical activity a day to be considered the ideal physical activity. And we know, as America, that that's tough to get in. Walking is probably the easiest place to start, especially if you have not worked out in a long time. It's easy to do. It can pick up your heart rate. You can do it with a friend. You can do it any time of year. If it's wintry and you can't get outside, malls actually open early and generally have walking paths within the malls so you can go indoors and walk. There's lots of ways to incorporate walking throughout the year, spring, summer, winter, or fall. If you need a break in your exercise routine, try to break it up into 10-minute increments. If you can't fit in 30 minutes, if you can't fit in 40 minutes, breaking it up, those small incremental steps to try to get in the physical activity that you need. The other thing you might want to do is perhaps challenge yourself. Getting back into a routine can be challenging, but if you make it fun for yourself, it can encourage you and motivate you to engage in physical activity. Push-ups are a great way to build your core and are a great way to improving your physical health. Yup, they can definitely be difficult, especially if you haven't been active in a long time. So of course you want to start gradually. You may want to modify the challenge you see here on the screen so that you can meet to your own personal physical ability. So if you haven't worked out in a really long time, perhaps day 1 is 1 push-up, and so forth and so on. But challenge yourself, make it fun, try to motivate yourself to get engaged in physical activity. Again, walking's free, easy to do, one of the safest activities. Physicians will always recommend that you include walking into your physical activity regimen. Here's a great walk-in challenge for you that you can incorporate it into your daily routine. Again, if you haven't worked out in quite a while, modify this down to 1 minute, 2 minute, 3 minute, so that you're building incrementally over time. Small incremental change leads to lasting and sustained behavior change. I know we've talked a lot today about the good things you should do, the scary part about metabolic syndrome, but I'm hoping that you understand that knowing your numbers is an important, essential component to knowing if you're at risk for metabolic syndrome. Your cholesterol is an important component of that as well. If your worksite offers Know Your Numbers campaign, I encourage you strongly to take advantage of this. Self-assess. Look at waist circumference. Go to a pharmacy or community where you can get your blood pressure checked to determine if you have at least 2 of those 5 risk factors. And if you do, it's time to make an appointment with your physician. I hope today this presentation has increased your knowledge about metabolic syndrome and how you can even prevent or delay your risk for developing metabolic syndrome. I want you to embrace everything that we've talked about today so that you can lead a happy, healthy, and wealthy life. Thank you so much for attending, and have a great day and a great life.